Mike, today we're talking about episode 15, the Lifelines of Storytelling in Congenital Heart Disease Care. And our guest was Vittorio Borrelli. What resonated with you from that episode?
Yeah, man. Well, of course, you mentioned in the podcast, me and Vittorio know each other, right? We actually went on a young adult cancer survivor trip together, and so we sort of have that shared history as well. So I just loved hearing about this part of his life. First of all, it was just really cool to hear about. But another thing that I really appreciated what he said is when he shared his story and sort of facilitated a conversation with some physicians afterwards. One of the doctors says, wow, I had no idea how much a part of your identity having congenital heart disease is.
Mhm.
And I thought that was really profound because I think whenever you have a life-threatening medical condition, yes, there's the medical part of it, but I would say one of the biggest things that happens outside of the hospital is the impact on your identity, right? It shapes who you are and it changes who you are. And I think the healthcare system has never been very good at acknowledging the impact of these life-threatening illnesses on people's lives, right? And so, what I loved about that conversation between him and his doctor after they watched the story is how digital stories can help healthcare providers make that shift from just the focusing totally on the illness to focusing on people their entire lives, right?
Mhm.
The whole person care that we're always striving for. Digital stories can help people recognize the impact on the identity of some of these very serious medical conditions. So,
Mhm.
so that was the first thing that really stood out to me as I was watching. But another thing that stood out was when you were talking about how this was a very meaningful workshop for you because you were working with young adults who have congenital heart disease, and you currently have a preteen with congenital heart disease. So it's almost like you got to see into the future. And for certain, for many workshops are formative, but there's certain ones that are very formative. And I wanted to ask you just a little bit more. What was so meaningful for you working with, I guess, getting a glimpse into the future for something that may be part of your own family?
Yeah. Well, Christina ran that workshop with me, and we both had conversations about just getting to hear that perspective from adults who have gone through this. And it's interesting because you mentioned that piece about identity. Yes, it's a huge piece of the identity for the congenital heart patient, but I,
Mm-hmm.
as a mom, that is a part of my identity, being the
That
parent of
is.
somebody with congenital heart disease. And so
Mm-hmm.
I just, that workshop was amazing and I find this is true regardless of what workshop you're working on. People feel that cohesion and that group atmosphere and sharing
Mm-hmm.
stories and listening to other people's stories. But as a facilitator, that one really stood out because there was just so much overlap with my own life. And I got to ask questions like, what does it feel like when they test a pacemaker? Because Kane can't really tell me that yet. And
Yeah.
I
Mhm.
I love it. I am bringing that to a couple of congenital heart conferences. And so
Mhm.
we'll see what happens
Yeah.
as we
See
share
where it
that
goes.
story further. Yeah.
Yeah, and I mean, here you are gonna be a parent of a young adult someday, right? And here you are. Yeah, I know it's hard to think about, but here you are sort of getting a glimpse into what that could be like and to understand his experiences as a congenital heart child, man, I was just thinking as I was listening, what a valuable thing for you to get to experience, to get a look behind the curtain of what it might be like for Kane, right? So,
Yeah.
so anyways, that was another thing that stood out to me. But then finally, I would say I loved how he talked about at the end. He showed his story at a conference, and normally he's really worried about it, a little nervous, to get up on stage. And he didn't have to worry at all because he'd put in the work already on his
Mhm.
story, right? And man, I love that, right? He said he could sit back a little bit at the conference, and I love that idea that yeah, when you do the hard work of
Yep.
creating a digital story, then you go and when you talk about your experience in public, it takes the pressure off because you already know this story is going to have a huge impact on the audience, and the rest is just icing on the cake, right? And so just encouragement for people who are thinking about doing digital stories. It's worth it, and it helps you clarify what you want to say, but it also takes the pressure off when you have to get up and talk about your experience.
Well, that was episode 15, the Lifelines of Storytelling in Congenital Heart Disease Care. Go and have a listen if that piqued your interest.